The World Health Organization says it will look into suspicions of negative side effects of the AstraZeneca vaccine. This comes as more countries have suspended the use of the vaccine. They include the Netherlands, Thailand, and the Democratic Republic of Congo.
More countries have suspended the use of AstraZeneca vaccines as a precautionary measure after reports of blood clots in people who had received the vaccine from 2 batches produced in Europe.
WHO Director General Dr. Tedros Adhanom Ghebreyesus says at the moment there is no proof yet that the drug is linked to causing blood clots. He added that the WHO Advisory Committee on Vaccine Safety has been reviewing the available data and is in close contact with the European Medicines Agency and will meet tomorrow.
This does not necessarily mean these events are linked to vaccination, but it's routine practice to investigate them. And it shows that the surveillance system works.
Earlier Monday, France, Germany and Spain decided to suspend the use of the AstraZeneca Oxford COVID-19 vaccine as a precautionary measure pending an assessment by the EMA, which authorized its use in the European Union on January 29. Previously, Austria, Italy, Bulgaria, Denmark, Romania, Estonia, Lithuania, Luxembourg, Latvia and non-EU countries, Norway and Iceland, had already fully and partially suspended the use of the AstraZeneca vaccine. Speaking at a press briefing at the WHO headquarters in Geneva, the WHO chief also addressed the issue of inequality in vaccine distribution. Meanwhile, Boris Johnson has said that the government is confident in the safety of AstraZeneca's COVID-19 vaccine after a number of European countries announced they were temporarily suspending its use.
We have one of the toughest and most experienced regulators in the world. They see no reason at all to discontinue the vaccination program and they are for any of the vaccines that we're currently using, either of the vaccines that we're currently using. They believe that they are effective, highly effective in driving down not just hospitalization but also serious disease and mortality. So we continue to be very confident about the program, and it's great to see it being rolled out at such speed across the UK.
The greatest threat that most countries face now is lack of access to vaccines, as some of the world's richest countries are buying enough vaccines to immunize their population several times over, while many other countries have nothing, he said. He continued to call on all countries to work in solidarity to ensure that vaccination begins within the first 100 days of this year. He said no country can simply vaccinate its way out of this pandemic alone, and that we are all in this together.